So Dr. Das, Arineta is just so excited to have our very first SpotLight system in the world here at C3, Connected Cardiovascular Care in Dallas. Our vision as a company is to take all the evidence that's been produced by university and academic settings about cardiac CT and make that a reality for patients at point of care. And C3 is really the ideal setting for us to bring the world's first SpotLight system to your practice, to put that in the hands of a leading practitioner that can demonstrate the viability of cardiac CT as the first line test for patients.
Well, I really have to congratulate you to have that vision, Scott. I think that one of the things that has always been important for practitioners is to have access to the best and the fastest and the most predictable scanning for our patients. And we want to be able to do that in settings that we are seeing patients in on a regular basis. Sometimes, as you know, getting patients into an academic center or even into community hospitals can take days, weeks, or months for the imaging to be able to be performed. And so having it at the point of care in our office, the ability to take a patient who has chest pain or a cardiac condition and be able to evaluate them quickly, expeditiously, and expertly with a dual head 560 slice, incredibly fast scanner, and to be able to give them the results immediately is really a testimony to your vision.
Yeah. I think the immediacy part of it is really key because, as you know, cardiac patients, especially those with symptoms, that they rightly want their results right away. And what do you see as, before you got your SpotLight system, what were kind of the wait times that your patients would experience?
Yeah, so this has really been a big issue. We know that we can do, routine imaging in the office, echo, nuclear, those type of things. But when we wanted to get a CT scan, sometimes it was weeks to months even to be able to get CT scans performed. And if we wanted to add fractional flow to those, we also saw that added time to be able to get those images done. And quite honestly, part of the reason for that is because some of the CT scanners in town are not dedicated CT scanners for cardiac. And so one of the advantages that we have is that we have a cardiac dedicated CT scanner, fast imaging technology, and we really focus on cardiac and vascular care. And if the patients have symptoms or if the patients are worried, we don't want them to wait for months. Sometimes they come into the office and we tell them, okay, we're going to get a CT scan done on you, and then we order it and they say, well, why am I waiting 2 months to get something if you're so worried about me? So I think those are important issues, and it's been a great collaboration to be able to have this with your help in the office.
Yeah, our company was founded on this vision to bring cardiac CT to point of care. The clinical evidence is undisputed now. Cardiac CT level 1A in the guidelines. Some of the seminal studies showing a 41% reduction in either heart attacks or deaths from cardiovascular disease are reduced by 41% with the cardiac CT first care pathway. But if cardiac CT is only available in university or large tertiary care facilities, then it's just not going to be available to patients. Our data suggests that only 5% of patients nationwide that are indicated or appropriate for cardiac CT are getting access to the technology today. So practices like yours, can really alleviate that clinical challenge.
Well, certainly access to care is such a phenomenal part of the growth of cardiac evaluation in general, and it's such an important part of being able to provide these type of services for everyone, not just the elite that can get into the academic medical centers or other places like that through whatever channels they might have, but be able to go to your regular cardiologist in a city. And my kind of vision for Arineta and for these imaging centers is that they'll be in multiple cardiac offices. It's a small footprint, and it's a scanner that works very well into the workflow of our patient care. And we anticipate that there'll be multiple centers around the country that'll adopt such a philosophy as well.
Yeah, and what we're excited about at Arineta is that when you design a system purpose-built for cardiovascular CT, it can be the highest performance and highest quality technology, so you're not compromising any quality aspects, by bringing it to the point of care. And we can also make it more affordable. Arineta is making cardiac CT more affordable at the point of care setting.
Well, I think that the other thing, and people would have this question, is that Arineta is a smaller company. What kind of support am I going to get? How is the process going to work? Is it going to be, as same as, one of the big three that are out there doing imaging like this? And honestly, our experience has been phenomenal. And not only has it been phenomenal with Arineta, but the support system that you've put into place. And the fact is that the imaging software, the upgrades, all the things that have to do with the imaging chain are really your technology.
Right.
So this is not something where we look at, everything is basically being brought by other companies into this process. This is Arineta software on Arineta devices, and when this technology is being supported the way that you have done it, and we've had a really seamless experience with getting this installed.
That's really great to hear. We've been delighted to work together with your staff. It's been a great partnership for the first month together here, but we're excited to prove that cardiac CT in the hands of practitioners such as yourself can really deliver the highest quality care. So
we're delighted to be part of this process and this journey with you, and I think that there's a lot more work to be done, and I think that cardiac CT is going to go from that few percent of patients to probably the majority of patients will be getting this before we know it. So thank you so much for working together.
Great. Thank you, Dr.
Thank you.